In this video, we are going to discuss about genicular anastomosis. So the genicular anastomosis is a dense interconnected arterial network located around the knee joint. It acts like a natural bypass system, maintaining uninterrupted blood supply to the knee even during extreme flexion where main arterial channels like the femoral or popliteal artery may be temporarily compressed. So this collateral circulation is especially critical during knee joint flexion, vascular surgeries, example like femoral artery ligation, trauma or blockages, and arthritic or ischemic joint conditions. So now we have to talk about location of this anastomosis. So the genicular anastomosis is situated deep around the articular surfaces of lower end of the femur, upper end of the tibia, the posterior and anterior aspect of the knee capsule. It also sends branches into the joint capsule and synovium. So think of it an arterial ring encircling the knee joint capsule like a flexible irrigation system that ensures all part of the joint receives adequate perfusion even when large vessels are kinked or compressed. So what are the arteries that contribute to the genicular anastomosis? So here I want you to focus very clearly in this, because in the exam they are going to ask you this segment. So here are the main contributors of the genicular anastomosis grouped by their parent arteries. First, from the popliteal artery, which is the main posterior contributor, whatever the branches we receive is superior medial genicular artery, superior lateral genicular artery, inferior medial genicular artery, inferior lateral genicular artery, and middle genicular artery that supplies internal knee structures but not the anastomosis. And next is the highest genicular artery, also called as the descending genicular artery, occasionally a branch of the femoral artery. So these are from the posterior and deep contributions to this genicular anastomotic network. Now coming towards the second artery. What are the contributors from the femoral artery? Anterior and descending. So one is the descending genicular artery, arises just above the adductor hiatus and mainly contributes to the medial and anterior part of the anastomosis. Now next is from the lateral circumflex femoral artery. The lateral circumflex femoral artery, we know that, which is a branch of profunda femoris artery, which is a branch of finally the femoral artery only. So what are the branches here? So the descending branch travels anterolaterally and contributes to the anterior lateral portion of the anastomosis. Now from the anterior tibial artery, just as it enters the anterior compartment, so the branches what we have is the anterior recurrent tibial artery, which ascends towards the anterior aspect of the knee and joins the descending branches of the femoral system. Right? This is what is all the arteries which are contributing towards the genicular anastomosis. For example, when you are visualizing this genicular network, the genicular arteries form an arc around the patella and the knee joint. If you see very carefully, the superior genicular arteries loop around the femoral condyles and the inferior genicular arteries wrap around the tibial condyles, and the descending branches, mainly from the femoral and the lateral circumflex, descend to meet the ascending anterior tibial branches. This is how the anastomotic network is formed. So together they form a 3D anastomotic web that encircles the joint posteriorly, medially, laterally and anteriorly. So all these are the arteries which forms the beautiful genicular anastomosis around the knee joint.